Prior to applying the materials in the applicator, it's important that the applicator assembly is inverted several times to ensure that the platelet concentrate is adequately mixed and homogeneous. It is also good practice to ensure that all air is removed from both applicator syringes by expressing a small volume of the combined materials into a sterile surgical sponge. The liquid applicator allows the platelet concentrate and thrombin activator solution to remain separate until the clinician is ready to apply the combined materials. This is accomplished by grasping the handle of the applicator as shown and slowly depressing the syringe plungers so that the two materials exit the tip of the dual lumen catheter, where they become mixed at a 10:1 ratio and are deposited on the surface of the recipient site. Typical time to form a gel or clot is 5 to 15 seconds. In order to localize the gel, the recipient site should be as horizontal, level, as practically possible in order to contain the materials until gelling occurs. If all the air has not been removed from either or both syringes, the end product may take longer to form a gel or may not gel. It is also important to wipe the tip following each use to ensure a clot does not form at the tip of the applicator. The liquid applicator can be used to make a biological membrane at the recipient site or in an appropriate sterile petri dish or specimen cup. If the latter is done, the membrane can be transported to the recipient site after allowing the membrane to set up for 1 to 2 minutes. Allowing the membrane to set up assures the membrane will remain intact and more easily transported to the recipient site. Following setup, the membrane may be dissected as needed to fit the recipient site dimensions. The gel can also be applied to a custom mold or shape to further accommodate a recipient site dimensions. A spray applicator is also available. It consists of a dual lumen orifice tip and, like the liquid applicator, delivers product at a 10:1 ratio. The spray provides for an efficient and convenient means to deliver the materials over a larger surface area and results in a thin biological membrane forming directly on the recipient site. Like the liquid applicator, the spray assembly is used by grasping the handle of the applicator as shown and slowly but deliberately depressing the syringe plungers so a spray is formed. Unlike the liquid applicator, the spray applicator delivery efficiency is improved by depressing the plungers in short deliberate bursts. This allows enough pressure to build within the spray applicator tip to allow the platelet concentrate and thrombin solution to form a spray as they exit the tip of the applicator. Depressing the plungers too slowly may result in the materials exiting the tip in the form of drips. It is also important to remember that, like the liquid applicator, the tip of the spray assembly must be wiped following each use in order to prevent a clot from forming on the tip. The liquid applicator provides a simple and efficient means to deliver platelet concentrate and thrombin solutions in a precise manner to hydrate freeze-dried bone particulate. This is accomplished by dispensing approximately 1 milliliter of platelet concentrate and thrombin solution for each gram of particulate. Larger granule-sized bone may require more volume per gram of bone than smaller granule-sized particles. Allow the gel to form. This usually takes 1 to 2 minutes. Then, using sterile instruments, pick up the consolidated bone patty and flip it over to ensure all bone particles have been coated with gel. If non-coated particles are seen, apply a small amount of additional platelet concentrate and thrombin solution and allow it to set up for 1 to 2 minutes. Following setup, the consolidated bone particles can be dissected or shaped as needed prior to transport to the recipient site. Application to hydrate freeze-dried bone particulate with platelet concentrate and thrombin solution provides for sufficient hydration of the bone materials, results in bone consolidation, and also allows for convenient transport of the consolidated bone to the recipient site. It also prevents bone particulate migration and provides for improved localization and stability at the recipient site. Platelet concentrate as well as platelet-poor plasma can be used to hydrate collagen membranes, bone particulate, or other biological materials that require hydration. Platelet-poor plasma without the thrombin solution can often replace the requirement for saline hydration of these materials and will improve the permeability and stability of these membranes when ultimately placed into the recipient site. Application of platelet concentrate and thrombin solution following the hydration step with platelet-poor plasma allows for improved penetration of the platelet concentrate. The fully hydrated membrane is more easily handled and transported and provides for improved stability when placed into the recipient site.